Hello guys, good afternoon. Welcome back to my YouTube channel. This is Professor Henderson. I hope you guys are having an amazing day. It's such a beautiful day outside. So I wanted to really take a little time to make a video about medical terminologies for doctors, nurses, and CNAs. I find like a lot of times the CNAs and the nurses, some of them don't really understand or don't even know the medical terminologies, and a lot of time these medical terminologies, they're used in test questions, and if the student do not understand the medical terminology, it's very difficult for the student to kind of get that question correct. So that being said, if you like these types of content and these types of material, please consider subscribing to my YouTube channel. Please like and share, and please drop your comments below. Let me know what else videos you would like me to provide you with. So the first question we have here is the abbreviation of TID. So TID stands for 3 times daily. And I'm going to give you an example of the TID. Maybe the doctor may want range of motion, passive range of motion to the right upper extremity, TID. So that's an example how TID is used. It means 3 times a day. The second one we have here is QID. QID stands for 4 times daily. Another example, maybe the doctor might say, I need range of motion to the right upper arm, QID, which means 4 times a day. The next one we have here is BID. BID stands for twice daily. Maybe on your plan of care as a CNA, you might have perform bed bath twice a day. Or if you're a nurse and you're giving out medication, you might have give an example of a medication that the nurse might have to give BID. Maybe the patient's blood pressure medications. Maybe doctor might have an order, say, administer Lopressor 25 milligrams BID. So that means twice a day. Okay, so we have another one here, and this one is very simple. This one is QD, which means daily. Monitor patients' vital signs, QD, which stands for daily. Okay, a lot of times when patients have knee replacements or hip replacements, I often see this term NWB, which means non-weight bearing. If they're just coming out of surgery or they were in an accident, you might the CNA might see this term NWB, which means non-weight bearing. We have another term here, BPS, BPM. BPM stands for beats per minute, and what do we measure in beats per minute? It's the heart rate, pulse. Like when you're doing a radial pulse, you might see 70 beats per minute. That's an example of beats per minute. AC stands for before meals. Sometimes there are medications that are ordered or things that are ordered, and the doctor may write AC before meals, take this medication before meal, or PC, which stands for after meal. PC, after meal. NPO, this is a common one the CNA sees on their care plan, where it says what sometimes patients are going for surgery and the doctor might have an order, NPO, nothing by mouth. And normally if the patient is scheduled for certain diagnostic tests or certain procedure, they might have NPO because they might be under anesthesia. Full weight bearing. FWB. This is a common one I see also on the care plans for the CNA. So FWB stands for full weight bearing. HR. This is not human resources. Don't mistake it for human resources. HR stands for heart rate. SA stands for sinoatrial node. So a lot of times when you're taking AMP1, anatomy and physiology, you'll see this word SA node. Is the sinoatrial node is the node where all the electrical activity is being initiated in the heart. NSR. This is another common one I see on the charts and stuff like that. And NSR stands for normal sinus rhythm. Like if you're working as a PCT, you see this common terminology used. Normal sinus rhythm means the patients don't have any dysrhythmias or anything like that. Okay, this is another one I see commonly used also. MRSA. MRSA stands for methicillin resistant Staphylococcus aureus. This is a common one I see a lot of times when patients have MRSA. It's transmitted through contact precautions. So a lot of times when patient has this, you have to use your full PPE, personal protective equipment, because this is very contagious. It could be transmitted through contact. So you have to wear your gown, mask, gargles, face shield, all of that good stuff with MRSA. They like to live in wounds and stuff. A lot of time patient has MRSA in their wound. So you will have all the PPE set up. So this is another one I see commonly on the nursing assistant exam, OSHA, which stands for Occupational Safety and Health Administration. So OSHA is a organization actually that they set standards for healthcare workers. The standards, for example, that in order to clean up a spill, you might have a blood spill, and they might have special instructions and policies and procedures how to clean up that spill. OSHA set standards and stuff like something get into someone's eye and they have a lot of these fountains, water fountains or eye fountains where they have to irrigate the eyes with water. So their main goal is focus on employee safety, setting safe standards for the employees, the people that are working for the organization. So, guys, I think this is it for this slide. I only had 15 slides on medical abbreviations. Again, if you like these types of content and these types of material, please consider subscribing to my YouTube channel. Please consider giving this video a thumbs up. Please like and share, and please drop in the comment section of this video what else videos you would like me to come up with. And I'll catch you in the other video. Bye for now.